Greetings and welcome to the GEHA Retirement Webcast. Thank you for joining us today. We also would like to thank you for the work you do on behalf of the American people. We appreciate your many years of public service. I'm Laura Noyes, GEHA's Account Manager for Alaska, Idaho, and Washington State. Joining me from Phoenix is Brian Sperling, our Senior Account Manager for Arizona and New Mexico. Brian's also our resident Medicare and retirement expert. Hi, Brian.
Hi, Laura. Hi, everyone. I'll be back at the end of the presentation to answer some of your questions. Feel free to submit a question at any time during the presentation in the Q&A box to the right. We have senior account managers on hand to help answer them. If we are unable to answer your question during the webcast, we will respond through your registered email address. Please note it may take a couple days for us to get back to you through the email process. I'd also like to point out the resource list under the Q&A box, which contains several downloadable PDFs. These documents offer a wealth of useful information pertaining to your federal retirement. And on a final note, a link to the recorded webcast along with a copy of the slides will be sent to the same registered email address by next week. Okay, Laura, we're ready to go.
Okay, thank you, Brian. Well, you may be joining us today because you or some of your employees are in planning stages of retirement, either getting ready to retire in a few short months or just starting to think about retirement down the road. As you can see from our agenda, there's a lot to talk about when it comes to retirement and Medicare, including whether or not to enroll in Medicare Part B, which is the most common question we get at retirement seminars. Speaking of seminars, if you would like your GEHA account manager to present this generic presentation to your employees, just click on the link icon below to contact your account manager. Seminar formats vary from agency to agency. Sometimes agencies' retirement specialists will present their own slides, and we will answer any plan-specific questions. If you'd like an all-carrier retirement seminar, your account manager will be happy to coordinate that as well. All we need is a room. In an effort to keep you from dozing off during this presentation, we've planted a few polling questions throughout the presentation. We hope you'll participate. Now let's get started. One of the first places you'll want to start for federal retirement planning is the retirement sections of OPM's website, opm.gov/retire. Postal employees should first visit lightblue.usps.gov, where you'll find retirement planning information specific to postal employees. Under the Retirement drop-down menu on the OPM website, click on the retirement system that applies to you. Here you'll find one of the most common helpful resources for your planning, the pre-retirement plan timeline. On the next page, click on the Planning and Applying link towards the left. This will reveal the timeline, which is broken down into tabs from 5 years or less to within months of retirement. Each of these tabs contains a checklist of actions that you should be taking at that stage in your pre-retirement planning. Another great resource is the Frequently Asked Questions link, also available under the Retirement tab on the OPM homepage. The FAQ pages have answers to hundreds of questions. They're broken down into 3 categories: pre-retirement, post-retirement, and leaving the government. Many of the questions pertain to health benefits in retirement, and that will be our focus today. One of the most important benefits you've earned as a federal employee is the ability to take your health plan with you after you retire without having to increase your portion of the total premium. In retirement, the government continues to pay over 70% of you and your survivor annuitant's monthly premium. Your share of the total premium will be deducted every month from your annuity. If your annuity is not large enough to cover your share of the premiums, you may change to a lower cost option or choose to pay your premiums directly to your retirement system. Your retirement system will notify you of your options and take whatever actions you request. Now it's time for our first polling question. Okay, I plan on retiring within a year, within 5 years, more than 5 years from now, never, or I'm not sure. Okay, we'll give you a few moments to answer these questions, and then we'll see what the majority of you say. All right, it looks like it's kind of split between within a year and within 5 years. So that's interesting, kind of on similar timelines. All right, well, let's go over some retirement ground rules with the Federal Employees Health Benefits Program, known as FEHB. In order to qualify for coverage after retirement, you must be continuously enrolled in any FEHB plan for 5 years before retirement, commonly known as the 5-year rule. The rule does not require you to be enrolled in the same carrier during those 5 years. The 5 years can include your time covered as a family member or under another person's FEHB enrollment. It can also include time covered under TRICARE or CHAMPUS, as long as you were covered under an FEHB plan at the time of your retirement. The Federal Employee Dental and Vision Program, or FEHBP, does not have the same 5-year requirement. You can enroll in any FEHBP dental or vision plan for the first time as a retiree, even if you were never enrolled as an employee, as long as you have an immediate annuity. If you cancel your FEHB coverage after you retire, you will not be permitted to re-enroll at a later date. If you join a Medicare Advantage plan or TRICARE in place of your FEHB coverage, you do, however, have the option after you retire to suspend your FEHB coverage. When you suspend your coverage, you may re-enroll during the FEHB annual enrollment period, unless you involuntarily lose your Medicare Advantage plan or move out of the plan's service area. After you retire, you may find your health plan doesn't suit your specific needs any longer, or your family status may have changed. As a federal retiree, you have the same ability as an active employee to make changes to your health coverage. Instead of using your agency's online portal to change your health plan, most retirees will use OPM's online services website for administering retirement benefits. OPM also offers a dedicated website during open season to make health plan changes for the upcoming year. Because retirees pay FEHB premiums post-tax, you can reduce your enrollment from self and family to self plus one, or from self plus one to self only. You can also cancel your FEHB coverage at any time. Remember that if you cancel your coverage, you cannot re-enroll. You can, however, cancel your coverage when you are covered under another FEHB enrollment during the period of time between your cancellation and the re-enrollment. You will be eligible to re-enroll when you lose your coverage under that family's member's enrollment. You also have the ability to change plans outside of open season for some qualifying life events. One event people are surprised to find out is not a qualifying life event is retirement. Retirement does not allow for plan changes outside of open season. Another thing some people are not usually clear on is whether family coverage is required at retirement. In fact, you are allowed to add a spouse or qualified dependents in retirement, which takes us to survivorship benefits, another great benefit of federal retirement. Survivorship benefits allow for your survivor annuitant to cover FEHB coverage after your death. There are some important rules to follow here as well. You must be enrolled in a self plus one or family plan at the time of your death, and at least one family member must be entitled to an annuity as a survivor. If you do not provide for a monthly benefit after your death, your survivor will not be able to continue coverage under the FEHB program. To make certain your survivor's annuity information is accurate, you'll want to schedule an appointment with your personal representative who can review your official personal folder, or OPF, with you. It's a good idea to review your OPF 5 years prior to and 1 year prior to retirement to make sure all of your records are complete and accurate. You should verify all your service and make sure your insurance coverage is documented. You can also review your election opportunities to provide benefits after your death to your spouse, ex-spouse, or another person you designate as having an insurable interest in your continuing life. Now that we have discussed a few of the more important FEHB regulations in retirement, let's talk about the parts of Medicare and how they work with the FEHB program. But before we do, time for another polling question. Okay, well, we've heard our name pronounced several different ways out in the field. How do you say our name? GEHA, 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 Government Employees Health Association, or none of the above? Okay, we'll take a moment here. All right, it looks like most of you are saying GEHA, but the actual way we do pronounce our name is GEHA. Okay, but I'm sure we'll answer to any of those. But we do pronounce it GEHA. All right. Well, Medicare began with two parts, Medicare A and B, now known as the original Medicare. You become eligible for Medicare when you turn 65 or when you have certain disabilities. Part A is premium-free for most people, and Part B requires a monthly premium. In the Medicare section of all FEHB plan brochures, you'll find the primary payer chart. This detailed chart outlines when Medicare is primary or secondary according to your employment status and other factors determined by Medicare. When you retire from federal service, Medicare will become your primary health coverage and your federal plan will become your secondary coverage. A little later in the presentation, we will discuss why you should consider delaying enrollment in Part B when you are still actively employed. You will not be penalized for late enrollment. Medicare Part A is commonly known as hospital insurance and is premium-free. Part A covers inpatient hospital care, skilled nursing facility care, home health care, and hospice care. Almost all federal retirees receive Part A without having to pay a monthly premium. Part A hospital insurance has deductibles and daily copays that are based on a 60-day benefit period. In 2018, the Part A hospital deductible is $1,340 for the first 60 days, then $335 per day for days 61 through 90. If you're in the hospital longer than 90 days in a benefit period, your 60-day lifetime reserve days would be activated. The copay for each lifetime reserve day is $670 per day. Part A can have some significant out-of-pocket costs. Your FEHB plan will help substantially reduce these out-of-pocket costs. Almost all FEHB plans pay Part A deductibles and copays on your behalf when Medicare is primary. Many people refer to Part B as the doctor portion of Medicare, but it's more comprehensive than just coverage for doctor visits. In 2018, after the annual deductible of $183, Part B covers services at 80%. Along with doctor visits, Part B covers outpatient hospital care, including emergency room visits, outpatient diagnostic tests such as x-rays and laboratory tests, durable medical equipment and supplies, physical and occupational therapy, ambulance transportation, and other outpatient services. Before 2007, Medicare Part B beneficiaries all paid the same standard monthly premium. After 2007, new enrollees paid higher monthly premiums based on income levels. In 2018, most new enrollees making $85,000 or less pay the standard monthly premium of $134, which represents a quarter of the total monthly cost of your Part B premium. In 2019, close to 91% of beneficiaries will pay the standard monthly premium. Those in higher income brackets will pay a greater percentage of the total Part B premium. Some beneficiaries with lower incomes may qualify for assistance in paying their monthly Part B premiums. Visit Medicare.gov to learn more about Medicare savings programs, which are available in every state. Because premiums for Part B have steadily risen over the years, and since premiums are now based on income levels, the decision on whether to enroll in Part B may take a little more thought and calculation for some federal retirees. Later in the presentation, we'll go over the factors you should consider when making your decision. But for now, let's go over how and when to enroll in Medicare A and B. Many federal retirees want to know, why should they pay Part B premiums every month when their FEHB plan covers these same services? FEHB carriers cannot require you to enroll in Medicare B. However, many federal retirees like the convenience, peace of mind, and potential savings when they have Part B. Almost all fee-for-service plans within the FEHB program will pay the 20% that Medicare doesn't. This means you will usually have 100% medical coverage. Those same plans will waive their deductibles and coinsurance for most medical services. They typically allow you to see any provider that accepts Medicare assignment anywhere across the country without referrals, even those providers outside the plan's network. Pre-certification is usually not required for hospitalizations and other expensive tests when Medicare A and B is primary. Some plans even pay for medical services when outside the U.S., something Medicare doesn't cover. Also, most FEHB plans will coordinate with Medicare electronically, so you won't have to file paper claims after going to the doctor or hospital. In recent years, some plans have offered rebates to help address the rising cost of Part B premiums and encourage retirees to enroll in Part B. Fee-for-service plans with low premiums may also help reduce your expenses, as they usually cover most medical expenses at 100% when Medicare A and B are primary. FEHB HMO plans vary widely on how they coordinate with Medicare. Most FEHB HMO plans will reduce or waive your copays and deductibles when Medicare A and B is primary. They may require that you continue using only in-network providers and obtain referrals to see specialists. Some FEHB HMO plans offer comparable non-FEHB Medicare Advantage plans with lower premiums than their FEHB premiums. This is especially true for states with large retiree population, where there is greater competition in the retiree market. If you decide to enroll in a Medicare Advantage plan, you may want to suspend your FEHB coverage. Some HMO plans offer separate enhanced benefit plans specific to federal retirees with Medicare A and B primary at no additional premium costs. Check with your FEHB HMO plan to see how they best coordinate with Medicare and which option best fits your needs. If you decide not to enroll in Part B when you have FEHB coverage, you will continue to pay your plan's medical deductible, copays, and coinsurance amounts up to the plan's yearly catastrophic limits. If acute care is needed in any given year, it may translate into several $1,000s out of your pocket. You should compare these out-of-pocket costs to the amount you'll pay for Part B premiums for you and your spouse per year. You should also consider you and your spouse's health status in the years preceding age 65. An interesting NIH study shed some light on when our healthcare dollars are spent during our life cycle. On average, we spend more than half of our healthcare dollars between the ages of 65 and 84. If we live beyond 85, we'll spend 2/3 of our health care dollars after the age of 85. This means the oldest group, 85 plus, on average, consumes 3 times as much health care per person as those aged 65 to 74, and twice as much as those aged 75 to 84. Only you know what risk level you are comfortable with. Some people are more focused on whether their out-of-pocket medical costs will exceed their premiums, while others value peace of mind and the convenience of easy coordination between Medicare and their FEHB plan, with low to no out-of-pocket costs for medical treatment. All right, now for our final polling question. Do you plan on enrolling in Medicare Part B after retirement? Yes? No? I don't know yet. I need to do the math. Okay, final question. We'll see what you say. Well, it looks like it's equally split between yes and I don't know yet. I need to do the math. Makes sense. All right. Well, signing up for Medicare is easy. The Social Security Administration is responsible for the Medicare enrollment process, and the Centers for Medicare and Medicaid Services, or CMS, is responsible for the administration of Medicare once you're signed up. If you already receive benefits from Social Security or the Railroad Retirement Board, you are automatically entitled to Medicare Part A and B starting the first day of the month you turn 65. You will not need to do anything to enroll. Your Medicare card will be mailed to you about 3 months before your 65th birthday. If you're not receiving Social Security benefits, you'll have to sign up for Medicare Parts A and B. Your window of eligibility is 7 months. It begins 3 months before your birthday month you turn 65. It includes your birthday month and ends 3 months after your month you turn 65. If you miss the initial enrollment period and you haven't applied, you'll have to wait until the general enrollment period from January 1st to March 31st to sign up. Coverage would then be effective on July 1st, and you may have to pay a penalty. Even if you don't plan on retiring before you turn 65, you should still apply for Medicare Part A. Remember, there is no premium for Part A, and you're entitled to it regardless of retirement status. Having Medicare Part A as a secondary payer will reduce your out-of-pocket costs should you be hospitalized, and it will help you keep more of that hard-earned money for retirement. The easiest way to sign up is online. Just go to ssa.gov/Medicare to begin the process. It can take less than 10 minutes to complete, depending on your situation. Social Security will process your application and contact you if you need more information. Otherwise, you'll receive your Medicare card in the mail. If you decide not to sign up for Medicare Part B when you're first eligible, you may be charged a late enrollment penalty. The penalty is 10% of the premium for the first year you do not enroll and is permanent. For every 12 months you are not enrolled in Part B, the premium penalty increases in 10% increments. There's one big exception to this rule. When you turn 65 and you are still enrolled as an active employee under FEHB or are covered under your spouse's group plan and he or she is an active employee, the late enrollment penalty does not apply to you. In this case, it might not make financial sense to enroll Medicare Part B just yet because your health plan is still considered the primary payer and Medicare the secondary payer. Once you or your spouse stop working or are no longer covered by the group plan, you'll have an opportunity to enroll without a penalty during a special enrollment period. This 8-month time frame begins the month after you retire. You also have an option to enroll at any time while you are covered by the group health plan. Medigap Plans, also known as Medicare Supplement Plans, cover the out-of-pocket costs associated with Medicare Parts A and B. These plans may be purchased for additional monthly premium and do not include prescription drug coverage. As you approach age 65, you will likely be inundated by direct mail and insurance companies selling Medigap or Medicare supplement plans. They may tell you to cancel your FEHB coverage and go with a cheaper plan. This is a red flag. They may not have your best interest in mind. Remember, if you cancel your FEHB coverage, you will not be able to re-enroll, not even at open season. One of the richest benefits you have as a federal retiree is that the government continues to pay over 70% of your monthly FEHB premium after you retire. Federal retirees do not need these supplemental Medigap plans because FEHB and Medicare will coordinate benefits to provide comprehensive coverage. In most cases, 100% coverage on most major medical services. FEHB plans also provide prescription drugs. Medicare C or Medicare Advantage plans are private health insurance plans approved by Medicare. To be eligible for a Medicare Advantage plan, you must be enrolled in a Medicare Parts A and B. When you enroll in a Medicare C Advantage plan, you will forgo traditional Medicare A and B coverage for a plan that usually covers much of the out-of-pocket costs associated with Parts A and B. Most Medicare Advantage plans also include prescription drugs. If you enroll in a Medicare Advantage plan, usually FEHB plans will not waive their plan deductibles or coinsurance when the Medicare Advantage plan is primary. There are a wide range of regional HMO and PPO Medicare Advantage plans available. Their premiums and out-of-pocket costs vary widely throughout the country and may be more limited in certain areas. Some plans require pre-authorization for certain care or referrals to see specialists and may limit your choice of providers within the network. Some plans only pay for emergencies outside the service area. In areas where there is a greater concentration of retirees and greater competition, these plans can be a good value. They may even include extra benefits like vision, dental, or fitness. If you do decide to participate with a Medicare Advantage plan, do not cancel your FEHB coverage. Suspend it. Medicare Part D is the latest addition to the Medicare program, is for prescription drug coverage, and has a separate monthly premium. Like Part C, private health insurance companies provide this benefit. OPM has determined that federal retirees who are enrolled in FEHB plan do not need to enroll in a Medicare Part D plan. OPM recommends reviewing plans before Medicare becomes primary. Becoming eligible for Medicare is considered a qualifying life event which entitles you to change to any FEHB plan and plan option beginning on the 30th day before you become eligible for Medicare. This change is only allowed once. Because Medicare A and B will be primary, a lower cost FEHB plan may be adequate for your needs now. If your needs change over time, you will have the ability to change plans every year during the FEHB open season. We'll end today's presentation by summing up some of the more common scenarios federal and postal retirees are faced with when Medicare becomes primary. The most popular option for federal retirees is having Medicare A and B along with the FEHB fee-for-service plan. In this option, you'll pay the Part B premium plus the FEHB premium. Those who have FEHB HMO plans may supplement their Medicare A and B coverage and reduce their out-of-pocket costs. Some HMOs have special enhanced plans for FEHB retirees for the same premium. If you enroll in a Medicare Advantage plan along with your FEHB plan, you will be paying your Part B premium, your FEHB premium, and most likely a premium for the private insurance company providing you the Part C coverage. Most people enrolling in a Medicare Advantage plan suspend their FEHB coverage and pay the Part B premium and the Part C premium to the private insurance carriers. Plans and premiums vary widely. The other option is not taking Part B and only paying your FEHB premium. This will depend on what level of risk you are willing to tolerate in retirement. If you are a military retiree, you are eligible for TRICARE for life when you enroll in Medicare A and B. You only pay the Part B premium, and no other premium is required. TRICARE for life also includes prescription drug coverage. And lastly, Medigap or supplemental plans require you to pay a Part B premium, a plan premium, and a Part D prescription drug premium. Federal and federal retirees do not need to enroll in one of these plans. Do not cancel your FEHB coverage if you enroll in a Medigap plan. Well, we'll close today's webcast with a brief description on how GEHA's standard option and high option health plans work with Medicare A and B. When you have Medicare Parts A and B as your primary insurance, GEHA waives deductibles and copays on both standard and high option plans. We also pay 100% of covered doctor and hospital expenses after Medicare's payment. The GEHA Express program electronically coordinates claims with Medicare for no-hassle claims processing. And you can visit any provider in or out of our network as long as the provider accepts Medicare assignment. You will also have peace of mind knowing your coverage goes wherever you go, even overseas. While the standard option and high option provide similar coverage, there are a few differences. One difference is the monthly premium. The other is how prescription drugs are covered. Retirees with Medicare A and B on the high option plan have a higher monthly premium but pay less for brand name medications. Vision benefits are included with all GEHA plans for no additional premium. Information about GEHA's Connection Vision, including $5 eye exams and discounts on eyewear, can be found at GEHA.com. For more detailed information on how GEHA coordinates with Medicare, visit GEHA.com/Medicare. On the right side of the web page, you'll find several retirement-related videos. You'll also find two popular downloadable guides, Countdown to Your Federal Retirement and Medicare plus GEHA Guide. Well, that ends my portion of the webcast. Please now let me introduce you to Brian Sperling, our resident retirement and Medicare expert, who will answer a few of some of the questions we have received today. All right, Brian, take it away.
Thank you, Laura. I'm going to start out with just a couple quick questions that have come in on the chat. I've got a great question here. It states, I turned 65 in December, but I want to continue to work for another year. What parts of Medicare do I apply for? Part A only? When do I apply for Part B, and is there going to be a penalty? All right, this is really a great question. It's multi-layered, and it covers a lot of aspects of what a lot of federal employees are dealing with. So if someone is continuing to work after the age of 65 and coming up on Medicare enrollment, what they can do is, what's generally recommended is to go ahead and select Medicare Part A. Since Medicare Part A generally for most people costs no premium, and it will be secondary to your federal health plan coverage, there's no reason not to select Part A. So even if you're still working or retired, taking Part A at 65 is generally a good idea. Now, since you have to pay a premium for Part B, and when Medicare will be secondary when you're still working, and in this particular scenario, this employee is still working past age 65, then delaying Part B is generally more recommended, since Medicare in the secondary role tends not to pay very well in a coordinated state. So generally it's better to wait till you retire and then select Medicare Part B. Now, if there is a penalty if you delay enrolling in Medicare Part B, but that penalty is only applicable if you aren't enrolled in current employer group health plan coverage. And since this employee is still working for the federal government and has their federal health benefit plan in place, they would be covered under a current employer group health plan coverage and would be able to do a special enrollment and avoid the Medicare Part B penalty. So they can add the penalty. They won't have to worry about the penalty until they actually retire. So in this scenario, this person's retiring at 65. Let's say or they're working past 65. Let's say they go ahead and retire at 67. They had already signed up for A at 65. Then when they reach age 67, they're simply going to enroll in Medicare Part B at that time. And there won't be a penalty as long as they do it 8 months from when they retire. That's the key to answer to this is. So if you're working past 65, just remember you can go ahead and sign up for Part A, delay enrolling in Part B, And then once you retire from federal service, you can go ahead and sign up for B at that point, but you'll have to get it done within 8 months from your retirement. If you miss that 8-month window, there will be a penalty assessed, which is 10% per year for each year you didn't enroll in Part B. So you don't want to miss it when you do retire. That's when you're going to want to take your Part B. I've also got another question I saw in here. My mother is a federal employee and has Medicare and is having to pay all of her medicines. Please explain. All right. So if someone has Medicare, keep in mind that if you've enrolled in Medicare Part A and Part B, that there is no prescription drug coverage in traditional Medicare Part A and Part B. You have to get prescription drug coverage either from your federal health benefit plan or from Medicare Part B. Now, luckily, most federal health benefit plans have prescription drug coverage built into them. Therefore, there's no reason to sign up for Medicare Part D. Now, it sounds like in this scenario, if she's probably having to pay some of her co-pays on her medications, which you will continue to pay even when you have Medicare A and B and your federal health plan. Even if that federal health plan waives co-pays and deductibles, you're going to end up mostly 100% on most of your federal health benefit coverage, but prescriptions is the one area where you'll continue to pay your co-pays. And that's because unless you opt for Part D, you're not going to have 100% coverage in that area. And even if you did select D, you still probably would have some out-of-pocket costs on prescriptions. And generally, it's not recommended that you take Part D. So I've got another question here. What happens if you have FEHB and TRICARE and Medicare? All right, so that's a great question. A lot of people have military service and also were career military and are eligible for the TRICARE retiree program and also have the FEHB program as under a federal civilian retirement. So what would happen in that scenario? And if you had Medicare also in there, then you're going to have, basically 3 levels of coverage. So generally speaking, for military retirees that have access to FEHB and Medicare and TRICARE, if you are retired, Medicare is going to pay first, then your FEHB federal coverage would pay second, and TRICARE would pay third, okay? Now, TRICARE requires that you take Medicare A and B, but the odds that you would need 3 levels of coverage are slim. So generally speaking, if you're eligible for FEHB, TRICARE, and Medicare, and TRICARE is going to require you to take Medicare Part A and B, you're better off just taking Medicare A, B, and having your TRICARE as your secondary, and then you can suspend your FEHB coverage in retirement. There's only 2 reasons why you can suspend your FEHB, and that's if you're trying out a Medicare Advantage plan, or you're using Medicare, or you're using the TRICARE program. In this scenario, that would be an appropriate use to suspend your FEHB coverage and have just the Medicare and the TRICARE. And then if you didn't like how your TRICARE was coordinating with Medicare later on, you could add your federal health benefit coverage back in, or if you needed access to maybe some specialized providers, sometimes the FEHB can help with those types of things. All right, so I'm going to go ahead and check a couple more for questions here. I'm still working and have medical coverage through my job. I also have Medicare. Should I also apply for Medicare Part B now? Okay, it's a very similar question that we had the first time around. So this question again, if someone's still working, they've applied for Medicare A, they went ahead and take A, there's no reason not to take A, but then go ahead and defer taking Part B until you actually retire. And that's because when Medicare is in the secondary role, it tends not to pay well as a secondary, and it often isn't worth paying the Part B premium yet. So in this particular scenario, I would recommend that you go ahead and take the Part A, defer taking Part B until you actually retire from federal service, and then you'll have that special enrollment period of 8 months to sign up for Medicare Part B. And again, don't miss that special enrollment period because if you do, then you'll be assessed a penalty of 10% for each year. So definitely don't miss that. And I'm going to just go ahead and check here for some more questions. I currently use the VA for my outpatient care. I'm a military retiree and TRICARE eligible enrollee. All right, we've got a lot of people using the TRICARE program. And I'm an employee with a high deductible policy for catastrophic events. How should I approach my continued enrollment into retirement? All right, so this person is going to be using TRICARE. If they have Medicare also in there, so if they have Medicare, TRICARE, again, this kind of is similar to the other question. I would recommend in this particular point is if you have Medicare A and B, you're retired, and have your TRICARE together, then I would go ahead and suspend your FEHB at that point and then reactivate it later on if you need it. That's probably be a simpler way to handle that. I've also got a question here, will my premiums increase once I retire? No, you'll pay the same premium as you paid while you were an employee. However, annuitants are paid on a monthly basis, so you will pay them at the monthly rate instead of the biweekly rate. And now, just a special note for post office employees, if you're a craft employee, craft employees often receive an additional premium contribution from the Postal Service, so you may see an increase in your premium, and it's just you're going to be paying the standard FEHB rate instead of the postal rates. But and then all other federal employees, their rates will stay the same. You'll just be paying monthly versus biweekly. I've got another question here. Can I change my FEHB enrollment at retirement? No, retiring is not a qualifying life event. Now, a lot of people think that it is, but it isn't. So you actually can change your FEHB enrollment at the federal open season, or you can do a one-time change when you turn 65. 30 days before you turn 65, you are allowed to change your FEHB health plan. And you can use that option, that feature only once, but you only turn 65 once, so that makes sense. And after that, you will have to wait till open season. But the act of retirement in itself is not a qualifying life event and doesn't qualify you to change your federal health plan. I've also got one more question here. Is my FEHB plan or Medicare the primary payer? All right, so here's the basic rule of thumb to remember with this. Your FEHB plan must pay benefits first when you're an active federal employee, and when you are retired, Medicare will pay first. All right, so when you're retired, it flips around. Medicare becomes the primary payer, and your federal health plan becomes the secondary, and then generally speaking, most FEHB plans will waive your copays and deductibles and net you out at 100% for most services. When they're the secondary, they'll kind of act as your secondary to Medicare, and then hence you'll end up with great coverage together. But the key thing to remember, federal health plans, when you're working, are primary. When you're retired, the federal health plan is secondary to Medicare. That's the key thing to remember there. All right, so I think we're going to go ahead and close out today's portion of the webcast. And I'd like to thank everybody for joining us. A link with the recorded version of the webcast and a copy of the slides will be sent to your registered email by next week. If you haven't received a response to your submitted question yet, we will respond through our registered email as soon as possible. Thank you again for your public service, and have a happy and well-deserved retirement.